Hello everyone, I am Dr. Ravul Jindal. I am a Director of Vascular Endovascular Surgery at Fortis Hospital, Mohali. Today we will be discussing the treatment of an issue that affects many people around the world, around 10 to 14%. Varicose veins. Varicose veins are enlarged twisted veins that usually appear on the legs and feet. They occur when the walls in the veins weaken or fail, causing the blood to pool and the veins to bulge in the legs. So now let's jump to the topic of the day. What are the treatment methods for varicose veins? It's a very important question people ask us. The approach to treatment depends on the severity of the condition and the symptoms experienced by the patient. Firstly, we have conservative measures such as lifestyle changes. In some patients, we give compression stockings. So these can help relieve the symptoms and slow the progression of varicose veins. Lifestyle changes include like a regular exercise, maintaining a healthy weight, avoiding prolonged periods of standing or sitting, and elevating the legs when resting. So whereas compression stockings work by applying the pressure to the legs, which helps improve the blood flow and reduce the swelling in the legs. These conservative measures can manage mild cases of varicose veins and can significantly improve the comfort and quality of life. For more advanced cases, we have minimal invasive procedures like sclerotherapy and endovenous laser treatment. These techniques actually target the affected veins directly, causing them to collapse and fade away over a period of time. Sclerotherapy involves injecting a solution using a saline solution or a chemical foam into the vein. This irritates the lining of the vein, causing it to collapse and eventually be absorbed by the body. Endovenous laser therapy, on the other hand, uses laser energy to heat and seal the affected vein, leading to its closure. Both procedures are performed on an outpatient basis and typically requires minimal recovery time, and patient can join their duty next day. Another minimal invasive option is radiofrequency ablation, which can also work in the same way as the laser. During this procedure, a thin catheter is introduced into the vein and energy is applied to destroy the vein wall, and this causes the vein to close off, redirecting the blood flow to the healthier veins. Ablation is highly effective and can provide long-lasting relief from varicose vein symptoms with minimal discomfort and downtime. For patients with bulging varicose veins close to the surface of the skin, ambulatory phlebectomy is also recommended in some patients. This procedure involves making small incisions, usually less than 1/4 of an inch in size, along the path of the affected veins, and we can remove these veins from the body. Special hooks and forceps are required to take these veins out, and ambulatory phlebectomy is an outpatient procedure which can be performed also under local anesthesia and results in minimal scarring. In rare cases, surgical interventions like a vein stripping and ligation may be necessary, particularly when the veins are very big and there are complications, something like an ulcers. Vein stripping involves the surgical removal of the affected veins through the small incisions, usually in the groin or behind the knee. Ligation of these veins typically involves veins to be closed off and the blood flow can be moved through the deeper veins. These surgical procedures are usually reserved for severe cases and requires a long recovery period compared to the minimal invasive treatments which I mentioned before. So these were some of the treatment methods of varicose veins, and minimal invasive treatment works great for varicose vein patients in most of the cases. Remember, healthy legs are happy legs. So if you have any questions or concerns about varicose veins, don't hesitate to reach out, and we can provide personalized advice and guidance to help you find the most suitable treatment option for your condition. Thank you.